Hi everyone, I am Dr. Anita. So moving on to the congenital toxoplasmosis. So toxoplasma is the most common parasite to be teratogenic. So teratogenic means it affects the fetus. Okay, so this is the most common parasite that is considered as a teratogenic agent. So the incidence is approximately 1 per 1000 live births, and it can also cause encephalitis in HIV infected individuals. And regarding transmission, initially though it is asymptomatic, that is in pregnancy, most of the pregnant mothers are asymptomatic, but still the transplacental transmission can occur at any time during pregnancy. The pregnant mother may be asymptomatic, but still she can transmit the infection to the fetus during pregnancy at any time. And the tachyzoids or the infective form, which is the actively multiplying form, and this is found in peripheral blood, and this is an infective form that infects the fetus during pregnancy. Okay, and the gestational age is the most important factor that influences the fetal outcome. So gestational age is directly proportional to the transmission risk. That is, if the gestational age, as the gestational age proceeds, the risk of transmission is also increases, but the severity decreases. So severity in the neonate decreases, but as the gestational age proceeds, the risk of transmission to the fetus increases, but the severity in the neonate declines. Okay. So here you can see, that is in first trimester, if the mother acquires infection in the first trimester of her pregnancy, the incidence of transplacental infection is lowest. Okay, but the disease in the neonate is most severe. Similarly, in third trimester, if the mother acquires infection during third trimester in the later gestational period, so the transplacental infection is maximum. That is, the risk of transmission to the fetus is maximum, that is around 65%. But the infant is usually asymptomatic at birth. This is inversely proportional to the transmission risk. That is, and before pregnancy, that is if the mother acquires infection before pregnancy, so the fetus is mostly uninfected except when the mother is immunocompromised. That's why the gestational age is more important, and it's the most common influencing factor. Here the gestational age increases, the transmission risk increases, but severity decreases. So this is directly proportional, this is indirectly proportional. In this way you can remember. In toxoplasmosis, so as a gestational age increases, the risk of transmission to the fetus increases, but the disease decreases. So this is directly proportional, and disease severity in the neonate is decreases. It is low. Okay, the risk is maximum as the gestational age increases, but the severity of the disease decreases. So here this is a picture showing the life cycle of Toxoplasma gondii. Here the cats are the definitive host, and the man and mammals are the intermediate host. So the oocysts are passed in the feces of the cat, and the unsporulated oocyst becomes sporulated oocyst, and this sporulated oocysts are ingested by the mammals through contaminated food, water and soil, and also the tissue cyst. Ingested tissue cyst can also infect the man through contaminated undercooked meat. Okay, so here the oocyst, that is sporulated oocyst and tissue cyst, both can transmit the infection. And also here you can see the cat passes oocyst in the feces. This unsporulated oocyst becomes sporulated oocyst. This sporulated oocyst contaminates the food, water and soil. When these sporulated oocysts are ingested by this intermediate host, that is mammals, or these tissue cysts when ingested by the man due to undercooked meat ingestion, this can infect the humans as well. So here the sporulated oocyst and the tissue cyst both can infect the man and mammals. And also inside the man, So what happens? These tissue cysts and the sporulated oocysts transforms into tachyzoids. So here all the three, that is oocyst, sporulated oocyst, tissue cyst and tachyzoids, all the three can transmit the infection. So these tachyzoids present in the peripheral circulation that crosses the placenta and infects the fetus. So in this way the life cycle happens.